Good afternoon. My name is Keli Avila. Welcome to my collaboration and leadership reflection video for Nursing 4010, Leading People, Processes, and Organizations in Interprofessional Practice. As we make our way through this video, my goal is to successfully reflect on an interdisciplinary collaboration event, noting which ways were unsuccessful and which were successful in achieving desired outcomes. I also plan to identify how poor collaboration can result in efficient management of human and financial resources with supporting evidence from literature. Additionally, I will identify best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve better outcomes for both the patient and the team. First, let me provide some background. The experience I am sharing is a story of an interdisciplinary collaboration event I experienced as a charge nurse for my department. I have been a registered nurse in the operating room, or OR, for a little over 5 years in a level 1 trauma center. Over the last 2 years, I have taken on the role of charge nurse on the weekend shift. In this role, I collaborate with various doctors, nurses, and nursing administration to coordinate surgical procedures necessary for our patients. We provide a wide range of surgeries since we are a level 1 center and we must be prepared for whatever comes through our doors. The case that was called to me to the OR front desk was an emergent cesarean section, also known as a C-section, with a total hysterectomy by the resident on the labor and delivery floor, also known as L&D. This patient had been diagnosed with placenta previa, but the placenta had begun coming through the cervix, creating a true medical emergency with the risk to both the baby and the mother. I asked the resident about any specific needs for the surgical procedure so I could coordinate with my team of anesthesia and OR staff to be ready quickly. We proceeded with the setup, and the attending surgeon even came down to help. I was informed by our OR circulator to call for the patient. I called the L&D unit and informed their charge nurse that we were ready for the patient to come down to our OR front desk. She said she would notify the direct care nurse and they would be down shortly. In our hospital, the L&D floor isn't very far away, and since the attending surgeon had just been with the patient, it usually means that they were ready for transport quickly. However, about 20 minutes passed and the patient had not arrived to the OR. I called back to L&D and for an update, and I was told that the nurse was busy. The charge nurse on that unit also seemed quite irritated. I informed the attending surgeon of the update, and she said she would call the floor and ask what the issue was and why it was taking so long, as this was a true emergent matter. About 20 minutes passed, and we were all wondering what was causing the delay. Everyone seemed on edge, and I called the unit again. Spoke directly to the nurse caring for the patient and asked why the patient had not been transported for her emergent procedure. She said she had her hands full with other patients and was doing her best to make it down to the OR. Then the nurse asked if she could just bring the patient in a wheelchair. I quickly explained that that was not protocol or safe for that patient. However, I was instructed her to get a stretcher or a floor bed, whichever was quicker, and bring the patient down as soon as she could. The patient finally arrived at the OR front desk, and our team was ready to assume care. The attending was still upset about the delay, which she believed posed a risk to the mother and the baby. I assured her that I would file an appropriate care event report, and she thanked me and my team for our efforts to be ready. Poor collaboration and its effect on human and financial resource management. This patient's care and experience could have been executed more appropriately with more effective interdisciplinary collaboration and clear communication between medical teams. Had the direct care nurse communicated to their charge nurse that they were overwhelmed or had other priority situations, it could have been relayed to the OR or the attending surgeon, allowing us to address transportation options. Delays like this affect OR schedules and can have broader financial implications due to inefficient uses of resources. Additionally, the direct care nurse lack of preparation for transporting the patient highlights a need for education on an emergency surgical protocol. This literature emphasizes the importance of clear and structured communication in and amongst interdisciplinary teams. Diaz 2023 discusses the conditions necessary for effective interdisciplinary communication in critical care settings, emphasizing the value of formalized communication strategies to reduce delays and errors. Ingalls 2023 highlights the consistent teamwork training and standardized communication protocols, enhancing collaboration and minimizing inefficiencies, particularly in high-stress environments like the operating room. Identify best practice leadership strategies. The most important goal for the interdisciplinary team is to provide quality patient care and ensure patient safety. Solero and Bull 2021 emphasizes on fostering mutual respect and open communication and shared decision-making among healthcare professionals to improve teamwork and patient outcomes. Applying a transformational leadership style can have a positive impact and strengthen interdisciplinary collaboration. Transformational leaders inspire a shared vision, motivate teams to achieve goals beyond expectation, and foster innovation and adaptability. By building trust, encouraging collaboration, and empowering team members, these leaders create a culture of inclusivity and high performance. They align team efforts with organizational goals, driving innovation, cohesion, and sustained success, which ultimately results in a high-quality patient care. Identify best practice interdisciplinary collaboration strategies. Effective interdisciplinary collaboration relies on structured communication, mutual respect, and clear roles. Ingalls 2023 highlights the value of evidence-based strategies such as a standardized communication tool and regular team debriefings to improve interdisciplinary collaboration. These practices promote transparency, reduce misunderstandings, and ensure all team members are working towards shared goals. Diaz 2023 emphasizes the importance of fostering a culture of open communication and psychological safety in critical care settings. Training sessions focused on team building, exercises, and conflict resolution can further strengthen the collaboration with interdisciplinary teams, enabling them to provide timely and efficient care during emergencies. In conclusion, I feel this experience underscores the critical importance of effective interdisciplinary collaboration and strong leadership in ensuring timely, safe, and efficient patient care. I believe that by addressing communication barriers and adopting best practices in leadership and collaboration, healthcare teams can enhance patient safety, optimize resource use, and foster a supportive and productive work environment. Reflecting on this event has highlighted many opportunities for growth and reinforced the value of continuous improvement in interprofessional practice.